After heart surgery, whether it is bypass surgery, valve replacement, or another major cardiac procedure, medications become as important as the surgery itself. Yet this is exactly where many patients unknowingly make mistakes that send them back to the hospital. And as a cardiologist, I want to explain this clearly, calmly, and honestly, because most of these readmissions are preventable, and they do not mean the surgery has failed. They mean the recovery process has gone off track. The first and most common mistake is skipping or forgetting doses, especially once patients start feeling better, because the pain reduces, breathing improves, and confidence returns. But medications like blood thinners, beta blockers, ACE inhibitors, statins, and diuretics are not short-term comfort drugs. They are protective medicines that stabilize heart rhythm, prevent clots, control blood pressure, reduce strain on the heart, and protect surgical grafts and valves. And missing even a few doses can trigger complications such as irregular heartbeat, fluid buildup, chest pain, breathlessness, or even a heart attack or stroke. The second major mistake is incorrect timing, where patients take medicines at random times each day, not realizing that many heart drugs require consistent spacing to maintain stable blood levels. For example, taking beta blockers too late or skipping morning doses can lead to fast heart rate and anxiety, while taking diuretics late in the evening can cause dehydration or nighttime falls, especially in elderly patients. Another dangerous but very common issue is stopping medicines too early, particularly blood thinners and pain medications, because patients fear side effects or believe they are dependent. But stopping blood thinners without medical guidance can cause clot formation in bypass grafts or artificial valves, while abruptly stopping beta blockers can cause rebound hypertension and dangerous tachycardia. Many patients also unknowingly mix prescribed heart medicines with over-the-counter painkillers, cold medicines, or herbal supplements, assuming that, if it's available without prescription, it must be safe. But common drugs like ibuprofen, certain cough syrups, or herbal products can increase bleeding risk, worsen kidney function, raise blood pressure, or interfere with heart rhythm, leading to emergency admissions. Another overlooked mistake is incorrect dosing, where patients misunderstand instructions, take double doses if they miss one, or confuse similar-looking tablets, especially when prescriptions change after discharge, which is why pill organizers, written schedules, and caregiver involvement are so important in early recovery. Dehydration and electrolyte imbalance due to improper use of diuretics is another frequent cause of weakness, dizziness, low blood pressure, and fainting, especially in hot climates or when patients restrict food and fluids excessively out of fear. Fear itself plays a huge role, because anxiety about side effects often leads patients to reduce doses on their own instead of discussing concerns with their doctor. And this silence is what turns small issues into major complications. Poor follow-up is another contributor, as patients skip scheduled reviews, blood tests, or INR monitoring for blood thinners, thinking everything is fine, while silent problems are building underneath. And finally, lack of education and clear communication at discharge leaves patients confused, overwhelmed, and afraid to ask questions, which is why I always tell my patients that no question about medication is silly, because your recovery does not depend on bravery, it depends on clarity, consistency, and communication. And the truth is this: heart surgery repairs your heart, but medications protect that repair, and when taken correctly, they dramatically reduce complications, speed healing, prevent readmissions, and give you the confidence to return safely to normal life. So if you are a heart patient or caregiver watching this, your most powerful recovery tool is not just rest or exercise. It is understanding your medicines, respecting them, and partnering with your cardiologist to use them safely, consistently, and without fear.